Welcome everyone to today's webinar, How UC San Diego Health's Care Navigation Hub Transformed Care Access Across the Health System. On behalf of Becker's Healthcare, thank you for joining us today. Before we begin, I'm going to walk us through some quick housekeeping instructions. So we'll begin today's webinar with a presentation, and we'll have time at the end of the hour for a question and answer session. So you can submit any questions you have throughout the webinar by typing them into the Q&A box there on the side of your screen. Today's session is also being recorded and will be available after the event. You can use the same link that you used to log into today's session to access that recording. Lastly, if at any time you don't see your screen moving or have trouble with the audio, please try refreshing your browser page. And you can also submit any technical questions you have into that Q&A box there on your screen. We are here to help. With that, I'm so excited to introduce today's speakers joining us. We have Katrina Bidwell, who's the Operations Director of Care Navigation Hub at UC San Diego Health. We have Danny Fleischer, who's a Managing Director with Tegria, and Scott Detremont, who's the Chief Revenue Officer with Parlance. So Katrina, Danny, Scott, thank you so much for being here today. And I'll now turn the floor over to you to get us started with the presentation.
Thanks, Daniel. We're really excited to be here, Katrina, Scott, and I, to talk about UC San Diego Health's Care Navigation Hub and how they've helped transform access across the health system. So today we're going to talk about four things. One is how to put the patient experience at the forefront of your access center, how to create very patient-centered design. I'll talk a little bit about how to benefit from a targeted management consulting and engagement, when it makes sense to engage an external partner and how you can best leverage and partner with each other. We'll talk about how to design and implement a successful enterprise-wide phone number that helps to support your brand, and how to build a contact center with high employee satisfaction and low turnover. To tell you a little about Tegria, Tegria is a healthcare consulting and managed service organization. We work exclusively in healthcare. We have over 4,000 employees and work with over 500 clients. And if you haven't heard of us, it's because 70% of our clients are via referrals. So much of our work is based on doing good work with one customer and winning work with another customer. We really provide solutions across the healthcare continuum. I work within our patient access centers team. We work with organizations that want to improve their patient access, their consumer experience, things like scheduling, things like registration, nurse triage. How do you make those more consistent? And how do you also create a good digital experience for your patients who are accessing your health system? What's unique about our team is that we're all doers in this space. So I have 40 people on my team. About a third of us have built large-scale access centers within health systems. About a third of my team are technologists that specialize in things like electronic medical record workflows or digital engagement. And about a third of my team are contact center experts who focus on things like training and workforce management and quality assurance in the healthcare setting. So why we think this work is so important: we worked with the Harris Poll to conduct a survey of 2,000 US adults in 2022, so post-pandemic, to understand what was important for them when choosing a provider, and more importantly, when they choose to seek a new provider. 7 in 10 patients said they would change providers for convenience alone, whether they were happy with their current care or not, with ease of scheduling being the biggest factor for patients in changing healthcare providers. So it's so critical to provide an easy access experience to patients because they have so many options in accessing care. So as health systems recognize the value of creating a truly seamless patient, consumer, and patient family experience, they oftentimes find that they need partnership in creating this sort of experience. So that's when it makes sense to engage a consulting partner for things like understanding your current state, understanding your benchmarking against the industry, kind of measuring where you are against industry best practice, for help with creating your overall strategy and your roadmap planning. So what are the things that you need to think about in terms of organizational structure, technology roadmap, change management? Most importantly, in transformations like these, governance and change management, effective communication are really the make or break in terms of organizational success. A partner can help you with that. Organizational design and recruitment, just thinking about what does the structure look like for your new centralized access center. And then how do you effectively recruit for leaders in that organization? What types of positions do you need? What kind of job descriptions do you create? How do you get great people like Katrina to join your organization? A consulting firm can help you with that. Financial planning and ROI analysis, obviously very critical whenever you're making a large investment in transforming the patient experience, understanding what sort of value that's going to create for your health system, and then understanding how you should budget your capital and operating expenses over that transformation. And finally, what systems do you need to implement? What technology is important? How do you implement them effectively? Those are all important reasons to think about engaging a consulting firm as a partner. So in partnering with UC San Diego and with all of our customers, we help them think about what are the core infrastructure needs for an effective contact center and to really transform their patient engagement experience. The first is both your contact center platform as well as your digital platforms. More and more patients want to be able to work with you 365, 24 hours a day digitally. And those experiences need to really match and marry together with your live experience when your patients are calling you. We help organizations think about how to transform their electronic medical record workflows, as well as their customer relationship management platform. What does it make sense to implement? Very important in these type of operations to have top-notch analytics and decision support, incredibly data-rich environments, and you want to make sure that you're leveraging that to the fullest in terms of understanding your patient experience and constantly improving it. Things like workforce management in a contact center world, that's quite common to be able to forecast your call volume and to forecast your agent coverage needs. Quite native in most of the contact center world, something new for much of healthcare. Quality assurance, while quite common in most healthcare settings, there's unique needs in terms of quality assurance for contact centers, as well as training and education. Creating truly role-based training is really important, as well as, getting the right folks within your organization. That's ultimately going to be the biggest factor in your success, is having great leaders and great agents supporting your patients. So we're going to talk a little bit about when UC San Diego Health partnered with Tegria, kind of early stages, thinking about their ideation of the new care navigation hub and really how should they plan for this transformation. So we were originally contacted by UC San Diego when this was really recognized as a large strategic need for them. They just needed some expertise and help on going about it the right way. So during the first year, we really focused on understanding their current state. UC San Diego had a hybrid approach like many health systems. They had access, scheduling, registration centralized through one organization of about 180 agents for about half the practice. The other half of the practice was supported locally within clinics. So we helped to kind of evaluate their current state for outpatient scheduling, for procedure scheduling, which was often decentralized or blended, as well as things like clinical request. When you look at the reasons that patients contact a health system, oftentimes as many as 30% of communications are related to care requests, prescription management, orders follow-up, test results, care management. So thinking about how you're going to best serve those clinical requests is always really important in design. Then we moved into a strategic vision setting. UC San Diego is a transformation health organization. So they hosted an event called a 3P, where they had over 30 leaders from throughout the health system thinking about what they wanted their grand vision for care navigation to be. And after that presentation, developed roadshow events. So going kind of department by department to help communicate what that vision is. Then we helped with facility planning. So they had identified a new facility for this new operation, and we helped with some of the nuts and bolts around facility planning and helping with logistics. In parallel, we are also performing pilots. So pilots are really, really important. You create this big new grand vision, you've got to see if it works in action. So we worked with gastroenterology, one of their larger and more complex specialty lines, series of rapid improvement events and pilots to mirror this new care navigation hub concept. So that included things like introducing procedure scheduling along with outpatient clinic scheduling, introducing nurse triage and other clinical services within the care navigation hub. Some of the big wins that came out of that pilot, we were able to increase their capacity, their provider capacity, by about 20%. And that was just going through their electronic medical record templates, making sure that their provider templates were open and accessible. That led to about 15% volume growth, both for their outpatient visits as well as their procedure volume. We also did a lot of work looking at the work their nurses were doing within the clinics, which was often in service of patients that were calling or sending communications rather than helping serve the patients in front of them. So we were able to offload a large number of nursing tasks to administrators or other clinical personnel within the care navigation hub. So we had this new facility. We had these pilots. We had a strategic roadmap in place. Then we moved to the work around kind of long-term planning and design. So that included, what does the new organizational structure look like? What type of leaders will need to be in place in order to successfully scale this operation? And you'll meet Katrina, who was one of those leaders that came into the organization. Develop your technology roadmap. So what sort of systems will we need to invest in or improve or replace or enhance? Parlance is an example of a system technology that helped them improve their patient experience. And then financial planning, capital investment, operational planning. What is this thing going to cost? And then finally, we moved to a growth planning and readiness phase. Most importantly, UC San Diego put a lot of intentionality around governance and creating a collaborative team that can help to set direction for the Care Navigation Hub, and then manage effective communications at the leader level, communications at the frontline staff level, at the clinician level, making sure that everyone understands what's going to happen, what's not going to happen as part of this transition. And that all came together into a very comprehensive change management plan. After year 2, we were up and running, and then it was time to scale. So scaling included sequencing of new specialties coming into the Care Navigation Hub, integration of new technologies to enhance experience. A lot of work was put at UC San Diego into optimizing their Epic scheduling workflows, as well as their referrals design, because it was really important that we made the workflows as effective as possible for their Care Navigation Hub staff members so that they could provide seamless experience and seamless access to care. We put in a whole new reporting and analytics suite to leverage all of the data that was now available by having a single point of contact for the access, as well as enhancing and improving and customizing training and quality assurance, both for their Care Navigation Hub as a whole, as well as for the new specialties that were onboarding into the practice. So, as I mentioned, one of the pieces of technology that was important for UC San Diego was introduction of a natural language guidance system, so that patients who are calling for any number of complex reasons could get to the right person and the right team that could help them without having to go through one of those dreaded press 1 for, press 8 for, press 10 for type menus. So one of the pieces of technology we introduced UC San Diego to was Parlance, to be able to more seamlessly help patients navigate when they're contacting the health system. So now I'm going to hand over to Katrina, who is the leader of the Care Navigation Hub today. We worked with Katrina initially, and then she's really taken this organization to new heights in scaling it above. So happy to hand over and introduce Katrina.
Thanks, Danny. Hi, everyone. I'm Katrina Bidwell. I'm the Operations Director for the Care Navigation Hub at UC San Diego Health. And I'm going to talk quite a bit about this journey we're on to transforming the patient access across the system and really creating a seamless and beautiful digital front door for our institution. Some of the things we've been concerned about lately is really our double-digit growth. We are, of course, the only academic health center in the county of San Diego, city of San Diego, as well as you can see, U.S. News and World Report 2 years in a row, we are the #1 and #5 in California. We took a leading role, as any academic institution should, in helping our community during the pandemic and COVID. And as a result, we're seeing double-digit growth. So double-digit growth provides a lot of opportunities and a lot of challenges for health systems and for our staff. One of those is just ensuring that we have an easy and simple way for patients to come and access us. The other thing is ensuring that we're keeping our employee experience at the forefront. Double-digit growth means, or could mean, burnout, stress, and a lot of other things. And in partnering and working with our systems intelligently, we're really finding that we're able to work through these. Contact centers at best definitely can be very stressful jobs for frontline employees. One of the most important things you can do is really to set your team up for success, so that when that caller gets to them, they're getting to the right place. You're ensuring your teams have the tools and the information that they need, and it creates a meaningful transaction for the patient, and particularly for us in healthcare. because these aren't just conversations about credit cards and purchasing things. These are conversations about myself, my family member. Sometimes they're wonderful and happy. Sometimes they're very stressful for the patient. And it's important for us to create a system that is warm and welcoming, that creates that wonderful environment for both the staff and the patient to have that discussion, have the encounter. It's not just about scheduling an appointment. Sometimes we're transforming their life. So needless to say, it can be a very high stress job. And one of the challenges that comes from having an enterprise-wide phone number, if it's not planned correctly, is that you will often get many, many calls that simply go where they're not, that simply go to where they don't belong. And that is probably one of the biggest frustrations that you can have in a contact center, is put a phone number out there, everybody calls, and nobody gets to where they're going. The staff gets frustrated, they get burnt out, you drive out up a lot of calls, and more importantly, there's never any first call resolution. So when I came to UC San Diego Health, our contact center had put out a 1-800 number on billboards in the community, absolutely everywhere, as it has continued to be, but there were still some areas of improvement that were needed. Staff were simply smiling and dialing, answering calls, putting out fires. They were stressed and they were burned out. It was wonderful to partner with not only Tegria, but also getting that introduction to Parlance. When I came in, we didn't have Parlance implemented. And I was fortunate enough to be the director who was able to take credit for implementing a wonderful solution for our digital front door that allowed the organization to kind of catch a collective breath. So, and that's really what we saw here, right? Patients were calling in, they were calling the number we asked them to call because it was everywhere, but they weren't necessarily going to the right place. It's frustrating for agents. It's frustrating for patients. There were handoffs upon handoffs upon handoffs. And at the end of many of those conversations, patients were asking us, why couldn't you just get me there in the beginning? Valid question. Our agents just couldn't catch a break. There really wasn't any time for training, for meetings, or any kind of meaningful QA because the calls were coming in too fast. And the abandonment rates were high because we were seeing volume, right, on this number that we simply did not need to see. So enter Parlance. One thing also that I should mention, first contact resolution. So I talked a little bit about that. Patients are frustrated, right, when they call in, and all of us as consumers, we have a limited amount of time to have these conversations. So when you call in, it's really important that you get the right person at the right place who can service your need. You can get in and out and move on with your day. Again, we were not providing that experience. And one of the wishes and one of the goals that came out of these Kaizen events and the A3s here at UC San Diego Health was really putting the patient experience at the forefront and providing that first contact resolution, right? I got to the right place, you heard me, and you're fulfilling my need. So in the beginning, it truly was a wish. When I arrived, it was firefighting. It was moving through calls as quickly as you could, a lot of that kind of stuff, but it almost seemed impossible that we could get to that vision of first contact resolution. So enter Parlance. We were able during the pandemic to implement Parlance. So while we were very busy with vaccine and vaccine scheduling and all those wonderful things, we were also able to partner with Parlance. They came in and we were able to give the patients and really leverage that single number reach that we were trying to do in the vision, right? Give the patients that wonderful experience. So callers just need to go where they need to go, and it needs to be seamless. They shouldn't have to think about pressing 62 buttons or always having 14 numbers in their phone for UC San Diego Health. They need to pick up the phone and dial and get connected to that person who's going to help them with their care. And that's where we are today. It's a wonderful experience. So we've got the number. Patients called in and I think what amazed me the most was how quickly they adopted the technology. Patient called in, asked for where they need to go, cardiology, Dr. Brown, primary care, schedule an appointment, and off they go. Talk about a staff satisfier for a group of people who were taking, upwards of 20% of their calls that didn't really belong to them, and feeling as staff, as glorified operators in the 411 for the organization. Wow, what a difference it made. And for the patients, not to have those not always seamless transitions from one department to another, from one agent to another, to finally get to that person in that place who could resolve their concern and help them. So really, really terrific care. One of the things I think that really hit home with me was a quote from a patient. She called and then sent an email as a follow-up. And she was talking to one of our care assist agents. So Danny talked about setting up that non-patient face-to-face team of RN triage and MA care assistants. And she spoke to this agent and she told me, I want to buy her a car, a house, a boat. She literally saved my career. And the great part about this story is she connected with this patient multiple times and was able to always get to where she needed to go to talk to that individual at UC San Diego Health seamlessly. I can't tell you what an impact it made for that patient. Similarly, one of our executive leaders recently rated his experience with 3 different departments coming through one number as a 10 out of a 10. So absolutely wonderful way to leverage technology to empower your staff and to get patients to where they need to go, so we can have those absolutely memorable, important conversations with them. So positive feedback. I mentioned briefly how quickly patients adopted this technology, and it really was eye-opening to me, having implemented several different types of technologies, not only here, but in other health systems. Patients were ready to engage with us this way, and they knew intuitively how to use the system. And the system is fantastic in that if the patient asks for something that we're not able to get them to, it's self-learning and correcting. So it only gets better and better and better. You always hold your breath when you implement something like this, whether it's a small controlled pilot, a big bang, you're always holding your breath a little bit. And I think one of the things that was most surprising is that we really don't have and haven't received any negative feedback. We have 1 or 2 patients that have called because the IVR didn't pick up their voice. And, that was primarily because they were driving on a cell phone. That's another conversation in itself. But patients, again, have just been able to use it intuitively, no complaints. Also, we have a family patient advisory council. And that's one of those meetings and one of those groups where you go in and you also hold your breath a little bit, waiting for that feedback. And what's terrific is this group also told us the change was simple and intuitive. And I think that's as far as messaging, something I can't stress enough. Having a simple, intuitive process and experience for the patient, so that they're really not thinking about how hard it is to connect with you, how difficult it is to get care. They're focusing on those great conversations and those wonderful people that they engage with, so that they want to buy us all a house, a boat, and a car. So one of the things I talk about often is the digital front door. And it has to be a pretty beautiful front door. It has to be wide and welcoming for patients, because if it's not, they're going to pass us by. And this is a big part of the experience here at UC San Diego Health is having that warm and welcoming digital front door. It's important from a contact center perspective because we need the patients to get to us quickly, get to the right place, get to the right agent, and not have to wait on hold for a long time. It's also very important for the patient when they walk through that door. that, to use the house analogy, right, it's not only warm and welcoming on the outside, but they walk into such a beautifully decorated home that feels terrific. So leveraging technologies like Parlance, and even going back to something Danny stated earlier with Tegria, working with your electronic health system and bringing it all the way down to having the appropriate decision support and templates create the opportunity for this to happen. So I often tell executives and others in the health system that access begins with us, begins with the care navigation team. Because if people can't access the health system easily and quickly, it doesn't matter how amazing the care is on the other side of that interaction, because they're never going to progress. So access is critical. One of the other things we often talk about is you can have the best processes, technology, but if people don't have access to great tools and support, they can't do their jobs well. If employees don't have access to technology and great processes and support from their leaders, it doesn't matter, again, how wonderful your digital front door is, they're not going to be able to do their job and satisfy the patient need. And in a contact center, that's everything. So it's really important when you're thinking about employees and employee satisfaction that you have these three pillars: process, people, technology, right? Tech is a big part of that. Technology where it makes sense, technology where it's intuitive, and technology where it's supportive. And processes, great processes. So Danny talked about it earlier, really leveraging your decision support, your EHR, and also for those of us in this space, leveraging your contact center tools, having meaningful QA, having workforce optimization and workforce management to the extent that you're matching that agent need with the patient demand. And we have the right number of folks on the phone so that when the patients walk through that beautiful digital front door, they're not waiting 20, 30 minutes to speak to an agent and listening to a lot of reminders about flu. They're simply getting to the person that they need to get to so that they can have that meaningful conversation. It's important too for us, the people piece. I can't stress enough how important it is to listen to your team. One of the things we do here is we survey our team. We have a joy meter, and we have a digital process, completely anonymous, where our staff can tell us how we're doing every single week. And we have reasonably high scores, and we're proud of that. But the thing that we love the most about that survey is the feedback. Because as great as you are, you can always do better. And that's the wonderful thing about contact centers. It's like playing golf. You're always trying to get a better score. And our staff are really great about giving us that feedback too. Not only feedback about their work life, but what they need to be effective. And if you look at the comments from when we started this journey to where we are today, we don't hear comments anymore about people getting to the wrong place. Why am I an operator? And all these other things. The comments now are giving us direction on other parts of their employee experience, and that's what we want to do. Not only do you need to get the comments, you need to review the comments with the team and, of course, take action. So we have a wonderful process here, and we're not only listening to our team, but we're putting in sustainable processes and efforts to make the employee experience better. And that's probably one of the reasons why we are lucky enough to have reasonably low turnover in a contact center and in a market like we're all experiencing these days. That's something that's always at the forefront. And I think I can't stress enough again how technology does help support that. Your teams need to be supported not only by great people and strong processes and governance, but also technology, so that we don't have that disconnect where they feel like they're the ones who are always bridging that gap because somebody didn't get the memo. So talking again about employee satisfaction and low turnover. When we were in firefighting mode and when I arrived, agents were taking 60, 80 plus phone calls a day, obviously about 100 on a Monday, and they couldn't help the patients on about 15 to 20% of those calls easily. What a frustration. Because they couldn't help the patient, that translates into a much longer call and service recovery, which is a longer talk time. For those of us in the contact center business, those are real dollars to the institution, right? The longer we're on the phone, the more that the agent has to troubleshoot like this, and they don't have the right tools, they don't know what they're doing, those conversations are longer, you need more people, it's a vicious cycle. Agents were not available to take the calls that they really needed to take because they were filling that operator mode. And for those of us in the contact center business, this is the terrible part. The abandonment rates were double digit, service levels were in the 20s. Now, I'm delighted to say that leveraging technologies, our abandonment rates are under 2%. Our service level is 85% year to date on this number. First call resolution is definitely a key part of the job. And it's satisfying not only for the patient, but for the agent too. I feel like nothing better than to be able to help. This is a type of business where we want to help all of us in healthcare. And there's nothing more satisfying for our team when they're able to resolve a patient need and move on to the next patient. They're truly now performing at the top of their skill set. Their skill set is not hospital operator. We have some phenomenal hospital operators. The skill set for this team really is assisting patients, registering patients, and helping patients with their needs. And again, they're able to assist patients easily and quickly, and callers are able to navigate to the places that they need to go. So when they're calling one of our institutions, or one of the areas that is not served by the 800 number, the caller never needs to know that. We put that number everywhere now, and very proudly, because we're giving them that wonderful experience of self-service. First call resolution and self-service, such important concepts. Our agents, as I mentioned, really want to help and assist patients and family members. In 2019, and when I arrived in late 2019, it was a metric. It was a metric we were beginning to measure, and a little bit maybe aspirational, but it became a focus of improvement. And today, it's really a given. First call resolution is strong. First contact resolution is strong, to the extent that we are looking at managing another metric now. And we will always be, of course, watching and tracking this metric, as we do with all our contact center metrics, but we're going to place focus on another area because we have been able to give our patients that first contact resolution 70 to 80% of the time. Now it is my pleasure to introduce Scott from Parlance, who will take us home.
Thanks so much, Katrina, and good morning or good afternoon, everyone, depending on where you are. Just briefly, a little more specificity about Parlance. Parlance is kind of an interesting company in that we're one of the pioneers of speech recognition and have been around for 25 years. And started off really, if you remember back to Katrina's stool, is strictly a technology company. We were a spin out of a major defense contractor called BBN Technologies that actually were among the people that invented the internet, came up with the little @ sign for your email and other really technical solutions like that. But as Parlance became an independent company and spun out, the company quickly realized that technology alone wasn't going to get it done, because no matter how good speech recognition was, if you didn't know where to send the call to, the caller experience would be a failure. It may have recognized your name as from a technical standpoint, but you may not have arrived at the right place. And so we turned to a service model and a partnership model with all of our customers that has served us well through all of the different generations of technology, and now including conversational AI technology. And the world has changed a lot. Back 25 years ago, there was no Siri, and you wouldn't think of using your voice to navigate a complex task like finding the right place in a healthcare system. But today, even though, people are a little bit older, my mom is now 80, she's willing to ask Siri where to go. So, the technology platform is kind of caught up with where we are today. This is sort of a sample, representative sample of some of the different systems around the country that we work with. I won't spend much time on it, but as you can imagine, being around a long time, there's a lot of different organizations that we work with. I like to think that even though we have the greatest technology, that the reason that Tegria ultimately recommended using Parlance were the things that you see on this slide and the partnership approach. Just as Tegria takes a really analytical look at processes and systems and people and governance, I like to think that they took a holistic look at the different vendors competing to partner with UC San Diego. And I like to think that when they took that look, Parlance really stood out beyond just the technology platform. And our approach to both patient experience and agent experience was ultimately what made the difference. For a long time, we've been touting the idea that you can't have good patient experience if that experience starts with calling the wrong number, sitting on hold, and being sent to the wrong place. And we know from experience that the ultimately best patient experience is where routine calls, where people know exactly where they want to go, those callers go exactly there, and on the calls where people really need the help of a human being, they're easily accessible. So it's not ever trying to have technology do the whole job. It's trying to have technology do the right job at the right time, so that agents, as Katrina has said, can work at the top of their skill set and support people that really need support for complex clinical appointment setting questions, et cetera. And that's really what we're all about. And that's really why we have been very excited to be involved in this project and watch it grow with Tegria and with Katrina's team. A bit of a case study within our effort together and kind of our partnership together. I think Katrina may have spoken just slightly too quickly about her experience with the pandemic, because it was truly heroic. For those of you that are in a different market, UC San Diego Health was highlighted as one of the primary places to receive your vaccine. And the number that she is referring to was on TV, billboards, in the press. And so call volumes spiked. They needed to be organized and handle incredible volumes, incredible pressure in a really dynamic and changing environment. And, we really, I think, worked well with them to support that. Katrina put together meetings with management and made really specific recommendations in conjunction with us to take COVID messaging rather than on the very front of the call flow and allow people to opt in. So rather than listening to 90 seconds of info about how to receive your vaccine, callers were asked to, if it's about COVID, mention COVID, and they were then able to go to a separate call path. And so rather than people being stuck in a long message and opting out and then sending more calls to the agents, they were able to be served by the different call flows that we worked out together. So it was really exciting. It was a great example of partnership. And of course, Parlance, like everyone, wanted to do their part wherever we could and really work closely with everyone involved to make it the best possible experience in a obviously horrible situation. Katrina, you probably have a lot to add to that.
Yeah, thanks, Scott. Absolutely. And I would be remiss if I didn't share a little bit about this story. I probably have a little bit of PTSD from all of that. And not the experience with you all, but the partnership was invaluable. And I'm truly grateful for my partners at Parlance, because I was calling them multiple times a day. Well, no, we're going to do this. Now we're going to try that. No, we're going to go this way. And collaboratively, we came up with let's just let people self-select and say COVID. Well, the simple act of having that intuitive choice for our patients literally saved our contact center metrics in our contact center. The agents then who were assisting patients with COVID information, COVID vaccine, nurses testing, all those things, got the calls they needed to get. And the agents who were doing the other wonderful and critically important work that continued on throughout the pandemic also got the calls that they needed. It was seamless, as we mentioned, and intuitive. And I probably could do an entire webinar on how wonderful that experience was and how important it was to ensure that we were able to intelligently route calls and give patients the experience that they deserved. And honestly, I don't know if we would have been able to do it as well without parlance.
This slide describes the call path and outcomes once people chose the COVID path and COVID information. So we're able to take a pretty granular look at what some of the outcomes were. There were some parts of the path where there was information read back about the vaccine. Other times when they did need to speak to a person, we got them to the right person. But it was great to be able to kind of look at and adjust to a dynamic situation and really serve that community well in a difficult time. I'll just let you read this, but you know what, the reason that we added this quote is just because this is what we're looking for. So we're really pleased that Chris's experience with us kind of mirrored our goals and kind of our mission and philosophy as a company. Because our primary business is supporting AI, conversational AI in healthcare, we have a lot of domain expertise around what happens inside these centers. And I think it makes us a great partner for people like Danny and people like Katrina. And we're always honored to be involved with people that are putting patients first and making a difference in healthcare. Daniel, at this time, we have some questions.
Thank you so much, Danny, Katrina, and Scott, for that great discussion today. And we'll now start today's Q&A session. So to our attendees, thanks for submitting these first couple questions here. Please feel free to continue to submit questions throughout the Q&A, and we'll keep going through as many questions as time allows. This first attendee wants to know, with huge increases in staffing costs and turnover nationally, how are you able to maintain staff without just ballooning your budget? I think this might be a great question for Katrina. Do you want to take a stab at it?
Absolutely. I'd love to speak to that one. And I think we touched on it and maybe didn't spend enough time on it when we were talking, but you know, I have a saying, you need to leverage technology where it makes sense, right? And in a contact center, every second counts, every minute counts. Those seconds and minutes, that's staff, that's dollars, and extra cost to the organization. So it's truly about managing down to that level to a certain extent and utilizing, you know, the science of contact center and your workforce optimization, but making every second, every minute count. Process efficiency. So decision support in your EHR, if you have an EHR that supports that, using decision trees and Epic, for instance, and or other tools that you can bring in from the outside on your EHR, saves a lot of time for the agent, and time saved for agents is fewer agents that I need to have on the phones, but also really important too, to have that front end, right? So if you think about what we were talking about at the beginning, the frustrating experience of having all these callers come to a group of agents who really shouldn't be talking to them, that drives up the queue so that the folks who need to get in there can't. Longer talk times, more calls, more abandon rates, that's more cost, right? We need more people, we need more people. And you really don't. You have to take it all the way down to the foundation, to continue my house analogy, and look at foundationally, what does your front door look like? You know, are the callers getting to the place they need to get to? And when they get there, what's the process that you have, and is it efficient and effective to allow those agents that quick, seamless transaction so that they can get on and talk to the next patient? So being able to leverage our technology where it matters to really drive that process efficiency. And again, it's like playing golf. We're doing this every day, right? It's a kind of a never-ending story to a certain extent. You always want to get better and better. Peeling those seconds away, you will then not need to have this massive empire of contact center folks.
Wonderful. Thank you for that explanation, Katrina, addressing it. And thank you to our audience member who submitted that question. This next attendee wants to know, what are the biggest challenges and benefits to providing this single number access to the health system? Scott, I think you might touch on this well. Do you have any thoughts here?
I do. You know, I would say that the single most important thing to think about before you go and roll out a one number environment is the directory and where the calls are going to go. You know, it is typical that we're engaged with institutions like Katrina's where the directories and number of places that someone could potentially ask for are in the tens of thousands. And we have been involved in many places where when a number was publicized, a lot of thought wasn't given to, well, sort of what happens next, you know? So we had one customer in the past that put a number on a billboard for an access center where the intent was to help people find a doctor and increase their market share in their market. And when the caller called, they had 9 IVR choices, and it just sort of tipped over the contact center. We were able to put a directory of 5,000 possible destinations there, and then all of a sudden it's the right place. And people didn't know they dialed the wrong number. So, you know, the big upside to one number access is you can retire some of your numbers that are published around the system. You can really have better leverage on marketing budgets. You know, I think today as I drive around here in the Northeast, I'm from Boston, I'll see a lot of billboards advertising some of the different healthcare institutions, and none of them have a phone number on it. And I secretly know it's because they know they can't, because chaos would ensue. So I think it's one of those things, like many in life, where it's a real opportunity on one hand, but you've got to be careful. So, you know, if you work with management consultants, people on the staff, and you are careful to map out sort of what happens when, it can be terrific. But it's go slow and be careful. And then once you've got it, it's then a case of really publicizing it and really committing to the one number. And your IT team will thank you, because they can start slowly but surely kind of winding down other of the hundreds of numbers that your institution may have for access.
Yeah, Scott, and if I just can add something on here, you know, it's a valid point, because I feel like we have 67,000 numbers in this institution, and, you know, they date back for years and years, and they're on someone's refrigerator. And that's an important point, because we're still working at it, and you're always going to work at it. But as you teach folks to come down to this single number, right? And as you make that reduction, it benefits everyone in the system. As you said, IS is happier, patients are happier, and they no longer have to have 27 different numbers in their iPhone for UC San Diego Health, just one.
Right.
Love to make it simple. Thank you, Katrina. This next attendee wants to know, it seems like there are a lot of costs to improving access, but how does this create value for health systems? Danny, do you want to tackle this one?
Yeah, I get asked that question oftentimes, because as you can see, this is a pretty transformative journey for health systems. It takes investment in people, process, and technology to do it effectively. And why is that worth it for a health system? So I'll talk about value in terms of value to your patients, value to your clinicians and your employees, and then kind of bottom line financial value. To your patients, obviously, as we expressed, the vast majority of patients are willing to seek care elsewhere if there isn't seamless access to care. So providing easy access to fantastic care providers is just of the utmost importance to your patients. And what's truly delightful for a patient is when they're able to access a health system and receive a very personalized experience, and they're able to receive that care in a really frictionless way. So it's really important, and really at this point table stakes from a patient perspective. And there's so many disruptors in healthcare that are looking to capitalize on their ability to improve upon that care asset experience. We want to ensure health systems with exceptional providers can provide that same level of experience. To your clinicians and to your employees, a lot of work in healthcare that happens within a physical clinic setting or happens within an inpatient floor is not related to caring for the patient that is in front of you. It's phone calls, it's portal messages, it's in-basket messages, it's any number of distractions that take away from caring for that patient in front of you. Our goal is to help create infrastructures like the Care Navigation Hub, where those services can be taken care of outside of the clinic setting by people that have specific training and tools and technologies to serve the patients, so that all of the time in the clinical setting is focused on the patient in front of you. And then finally, from a bottom line perspective, we mentioned some of the benefits we gained in the pilots. By removing barriers to access, by cleaning up systems, you oftentimes see significant increase in patient volume, increases in provider utilization, improvements in patient show rates, because they're able to access care more easily. Those all have very bottom line benefits. And oftentimes when we're looking at the return on investment for these type of organizations, there's significant multiples. And for those reasons, it's important to think about value to the patient, value to your clinicians and employees, and as well as your bottom line value as you think about going through this transformation.
Wonderful. I love how you broke that down to the three kind of top priorities. I know it always comes down to that bottom line, but thanks, Danny. Looks like we have time for just around one more question here. And thank you to our audience for submitting these. Please feel free to continue to submit them. Even this will be our last question. If we don't get to it today, we can be sure to follow up and get you an answer here. But this attendee wants to know, and Katrina, and then maybe Danny, I'd love to hear your thoughts on this. How do you account for the numerous complexities inherent in an academic medical center? We know there's lots of them. So Katrina, I'd love to hear your thoughts and then go over to Danny.
You know, it definitely very complex matrixed organization. And it's really like attacking any other project or problem or process. You need to, first of all, really be mindful and engage your partners. So I often say in this business, we have to be experts in two areas. We have to be contact center experts first and foremost to ensure that piece of it's being done, but I also have to be experts in your business and whatever that might be. So for my partners in the health system, it's really important that I stand by their side, engage with them, understand, listen, and work collaboratively to ensure that we're addressing those complexities and the concerns that come with it, and developing and creating a model and a system that serves them. Physician staff experience is high for us. It's huge for us. It's important, just as important as the patient, because again, that's part of that front door, right? If you walk in and I've got physicians who are not happy with the service they're being provided from Care Navigation because it simply doesn't address their need, or they feel like it's one size fits all, or whatever the concern is, then we're really not doing our job. So if it's complex, matrixed, you buckle up and you partner and you work together to ensure that your design is mindful, efficient, and appropriate. And then you have to check back in. I would hate to say that this is ever a one and done. Health systems change, they grow, they mature. If nothing else, during the last 2.5, 3 years, we've certainly learned how much we can change in healthcare. And as a result, we have to be ready to respond to that. We have to be fluid. We have to be able to check in and make those changes. And as recently as today, we're checking in and making changes with a couple of our service lines. And again, it's, you know, forming that partnership and being able to ensure that you can work collaboratively. I can't stress that enough.
So I'd like to echo and amplify everything that Katrina said. And I think what's very important to understand, with all due respect to other industries, is when you are seeking care, especially in an academic medical center, this is not booking a hotel room. This is not buying a charger. This is not calling for customer service for a utility. The stakes are much, much higher. The emotions involved from a patient are much, much different and higher. And you have to take that kind of same care and respect as you're designing these experiences for patients. For us, what's absolutely critical and what organizations often find to be a challenge is clinician engagement. So when you're accessing care with a cardiologist, especially for a complex interventional cardiologist, those workflows need to be both complex in terms of respecting the complexity of accessing care, but also seamless from an agent perspective. So we spend a lot of time with our clinicians and our clinical champions developing workflows and then creating technologies that guide agents through those workflows to ask the right questions, to look at the patient's prior medical history, to make care access decisions that are clinically sound. And that's really important as you're creating these type of care navigation hubs and access centers.
Wonderful. That is all the time we have for today. So I want to thank Danny, Katrina, and Scott for just a wonderful, wonderful discussion today, as well as Parlance and Integria for sponsoring today's webinar. To learn more about the content presented today, please take a moment to check out the resources section of the webinar console. And please do also take a moment to fill out the post-webinar survey. Thank you for joining us today, and we hope you have a wonderful rest of your day.